Also tonight, the Health Justice Initiative says the NHI Bill in its current form will not lead to patients accessing the best medicine that science has to offer. Government has also been accused of sidelining numerous sectors in the drafting of the bill. Let's speak now to the Health Justice Initiative founder and director, Fatima Hassan. Fatima, very good evening to you. Good to have you with us. As always, let's start with the basics. Explain how the bill in its current form would disadvantage access to medicine as well as issues around procurement.
Thanks, and thanks for having me on the show. So the way the bill is currently drafted, or the way we interpret the provisions in the bill, is it's going to continue with the system of parallel access to medicines, including selection, procurement, and what we believe is currently the situation in South Africa, which is uncompetitive pricing. And by creating parallel systems for medicine access, and that's the issue that we particularly focused on, there's other aspects of the bill that other role players are interested in, but our focus is really on, will you be able to access the best medicines that are available in the market through the NHI or through any system that exists in parallel? And some of the provisions are drafted in such an ambiguous and such a confusing way that there is very little clarity as to how the system is actually going to unfold in parallel to each other in the next few years.
And those issues that you've highlighted in your writing speak to, as I was saying earlier, procurement. You're also concerned about selection and the reimbursement system, which you say, from your reading, has not been given enough of a thorough, shall we say, explanation. What is missing, and does the process that follows now lend itself to possibly fixing or righting those wrongs?
So I think you've hit the nail on the head. The issue that we've had in South Africa in the last 25 years since the first democratic elections is that we've had two parallel medicine access systems. So if you were using the state facilities, you're accessing a basic package of services. If you have enough money to belong to a medical scheme, or you have money basically in your pocket through what's called out-of-pocket payments, you could buy better medicines available, better treatment, and better services. And so trying to merge those systems in the manner in which is basically envisaged in this current bill, to us and many of the experts who've been working on medicine pricing and medicine selection and medicine procurement issues, both in South Africa and around the world, are basically saying that this doesn't actually make sense. There's a lot of issues that you still need to address, and there's a lot of technical aspects of merging medicine selection and access systems. So the minister has been reported as saying this is a revolutionary bill. In our assessment and reading of it, it's actually nothing revolutionary. It really entrenches the status quo, and it allows even MPs who belong to a medical scheme called PharmEd to be able to continuously buy up even when NHI comes into play. So that doesn't really prioritize a basic package of services or the best available package of services for everybody living in the country. It means that you will still use wealth or employment as a proxy to be able to access what the better services are. And so we're really hoping that the provincial hearings that are going to now take place, because it's now going to the NCOP, has to actually have conversations around the technical aspects and the difficulties in merging systems and regulating parallel systems for at least, the way in which the bill is drafted. We think these parallel systems will operate for at least 10 to 20 years, because the assumption that medical aid schemes will cease to exist the minute the NHI is passed is actually incorrect. The schemes will continue, and even when NHI is fully implemented, schemes will be able to offer what's called top-up cover or complementary cover. So I think there's a lot of emotional reactions to what has happened yesterday. I think some of it is legitimate and granted, but I think there's also misinterpretations of what is actually contained in the bill, and those are the provisions that the NCOP really has to go through, because we are concerned that if you don't deal with this particular issue of medicine access, selection, procurement, in whatever system you're using while NHI is being implemented, that we could have a medicine access crisis in our country.
It's interesting to hear that you're somewhat optimistic, am I right, about the NCOP, National Council of Provinces process, which will now follow on what's happened in the National Assembly, given that one of your main complaints has been for a while now that basically the views of organizations such as yours have not been given enough of an audience. You've not been listened to.
So I think it's not just us. I think it's a wide range of stakeholders, but it's also the experts who have been working on these issues for decades. It's also academics, it's healthcare workers, it's trade unions, it's researchers. Political parties aside, I think that there is a cohort of people who have every interest in making sure that we have a proper healthcare service in South Africa, that the best healthcare is available to everybody, not just people who have money or people who have jobs. And really, it would be, it's a requirement for the NCOP to actually listen to all the different submissions. But I think at this point, where there's so many uncertainties as to the technical aspects of how the system is actually going to work, how is it going to be implemented, are we going to have different pricing committees for the different sectors, what's going to happen to the current system of medicine pricing and regulation for the private sector, what people call the single exit price system. How will the selection of medicines take place on the NHI? There's this benefits advisory committee that has been proposed. So there's a lot of proposals and, some here and there, a few creative ideas, but the details, the implications for it, the funding for it, the impact of it, I think really needs to be interrogated. And if the NCOP doesn't engage in that, then I think that also opens up government to further legal challenges down the road about, well, what was the nature of public consultation, in passing a law of such importance.
And if this section, or the medicine section of the bill is going to further perpetuate, shall we say, medicine's inequality, what value then is it that the NHI as a whole will hold in a country where inequality is present in every aspect of our lives?
Yeah, so that's what we're trying to decipher from this bill, because we're saying, well, what exactly are you changing? What more are you offering? What more are you allowing? Where is, the real commitment to price regulation across sectors so that you and I, irrespective of which sector we're using, we're getting the most affordable medicines at the most affordable price? We don't even have benchmarking. We don't even have pricing, international comparisons. So we're paying more for medicines than many other developing countries or middle-income countries. And in some cases, the private sector, you're paying more for the same medicine that you could get that's in the public sector, just because of different negotiating powers. But we saw in COVID and in the pandemic, and I think, the previous speaker also spoke about it, about not losing the lessons of what happened in the pandemic. It is very easy to further entrench inequality in access to life-saving treatments and vaccines. And we are really concerned that the bill doesn't really address those very pressing issues. And this will have a severe impact, not on people who have medical aid.
Right.
That will come down the road. It will have an impact on the millions and millions of people who have to use the NHI, who are required to use state health services because they're basically, that is all that they can access and they have no other option.
Fatima, Hassan, a pleasure to speak to you. Thank you for your time tonight.